All right, folks, welcome back to Cheddar's News Wrap. The state of Alaska on Tuesday officially becoming the first state in the entire country to make vaccines for COVID-19 available to all adults, regardless of age, regardless of medical conditions, or their status as an essential worker. Huge news. The state's governor, Mike Dunleavy, making that announcement at a press conference alongside state medical officials. And I had the opportunity to speak one-on-one with Alaska's chief medical officer, Dr. Zink, earlier today to talk all about how that state, Alaska, got to this place in the fight against this pandemic. Take a look.
We are so excited to be here, to be able to be on the offense against this virus and being able to open our economy and being able to move to a state of prevention. I think we've been able to get here because of tremendous partnership. We've really been able to partner with our communities, with our tribes, to be able to get vaccine out fast and fair across the state. And it's been great to be here. Also, by being able to move in big tiers, it's allowed communities to move kind of at their own rate and being able to do it equitably in their community. That makes sense. It looks really different in places like Unalaska than it does Anchorage. We're bigger than Texas, California, and Montana combined. So we had to really take in some of our geographic challenges, and moving through big tiers has been really helping us.
You and your colleagues before have discussed what you call the hub and spoke model of vaccine distribution. That may not be a phrase, Dr. Zink, that is really familiar to very many of our viewers. What did that mean, and what did that look like in terms of actual application of the vaccine in Alaska?
Yeah, so Alaska is definitely different in some of its public health structure. So we have a very kind of centralized public health structure with a bunch of itinerant nurses and nurses in multiple communities, as well as our tribal system. We built our entire vaccine system for COVID-19 based on our existing vaccine infrastructure and built in the tribes at every level. So our tribes were part of communication and planning and operations. And we were able to get vaccine into the center of the state, into Anchorage, into Juneau, and then to redistribute it quickly. We've been a part of the redistribution process for years, and then be able to get communities to invest in how they wanted to get it out. That might be going from home to home. That might be doing it in a tribal hall. That may be going by snow machine or by going by plane or having boat up clinics. It's looked really different across the state. So again, we've used our resources at a state level to really empower local communities to get it out as quick as possible, and really built on previous existing public health infrastructure. And I think it's just really highlighted to me how important communities are, how important the partnership is, and how important investment in public health is.
I'd love if you'd be willing to expand a bit upon that last answer. I mean, you mentioned earlier about the unique geographic challenges that Alaska would deal with, many of which no other state in the country has to deal with. And we've read reports about people even traveling via dog sled in order to effectively administer the vaccine. Talk to us a bit more about what some of those unique distribution strategies have had to look like, given some of the unique challenges that your state has.
Yeah, it's been really fun to see in general. Not only is it that we have a huge state, but this is happening in the middle of winter. So that has provided some additional challenges at the same time. So all sorts of examples. We had a shipment that was going out by plane. The weather was bad. The plane couldn't get in. And a boat captain said, hop in, I'll take you across the waterway and be able to get there. Out in Dutch Harbor and on Alaska, they're doing boat up vaccine clinics for all the people working in the sea right now, doing a lot of the fishing out there. Project Togo in the YK has just been fantastic. Project Togo is after the lead dog of the original, what the Iditarod is based off the original dog sled run up to Nome to bring toxin to help prevent further infection up in that region. And so that project initially started by planes going from community to community and healthcare workers coming up on snow machine to be able to be vaccinated on the runway strip, and then they would move to the next community. And then as they got more vaccine in, they started to do community to community. We've had dog sled teams as well as snow machine teams and people just walking literally from house to house to make sure elders are vaccinated across the state. So it's been really diverse in how people are getting it out. Again, people taking it to homeless shelters, tribal halls, prisons, being able to really meet people where they're at and get vaccine out there. We really want to instill vaccine confidence. And oftentimes that takes local trusted messengers and being able to partner with each other to get it out as quickly as possible.
That's incredible. Any story that combines human-to-human good faith with dog sleds is a great story in my book, so congratulations on getting that far. So far, of course, we've talked about 2 widespread distributions for vaccines, Moderna and Pfizer. We are soon talking more and more about the upcoming J&J approval, which will be a one-shot dose. What is your hope that the J&J edition will do for the distribution strategy in Alaska?
Yeah, J&J has been a game changer. We're already starting to get some in the States, limited quantities. We're excited for more. we are allocating to each of our census areas per census area. So we aren't saying use this vaccine for this or use that vaccine for this, but we're seeing communities use it in different areas. So, for example, the J&J vaccine, using it for the fishing industry, for people who want kind of a one shot. There's some people who really choose to want that vaccine for all sorts of other reasons. They only want one shot, or they don't like needles, and so they're choosing to get that vaccine. The great thing is all three of these do an amazing job at preventing serious illness and death. And so we're just encouraging people to use whichever vaccine they can as quickly as possible. We are also seeing it in things like airport. So we've had a really robust airport testing program in many of our rural hub communities. So when people come into what we call the off-road system, part of our communities that have no road going to them, you can only get there by plane. You oftentimes fly into a hub, a city, and then you have to fly into your rural village from there. And so by doing testing in those areas, we've been able to keep it out oftentimes of our smaller villages and to keep it from spreading so quickly, and building into that a vaccine program. So those who have not been vaccinated could potentially fly into those hubs, get vaccinated in that hub before moving to a more rural village to make it more efficient. So looking at using it in all sorts of different ways, including with our airports.
And finally, what would you say are some of the biggest learned lessons that perhaps other states in the United States of America can learn from the work that you've pulled off in Alaska?
I think some of the things I've been most grateful for is the partnership and the open communication. We have public science echoes that happen every Wednesday that are open to all Alaskans to come and ask our team any questions they want. And so we've been able to build on that for vaccine, and then really trusting and building partnerships with our local communities throughout this pandemic to really empower them. I've seen again and again through this pandemic, when we've been able to empower them with the tools and resources they need to keep COVID out of their community, they've been able to do it. So again, that partnership I think is really key, and it looks so different. What health equity looks like in our state, what distribution looks like, is so different depending on individual needs, what that population looks like, their concerns and their fears, as well as the supplies and resources they have. And so really relying on that really robust community involvement is key. Just like all politics is local, I really think all vaccination is ultimately local, and we have to really rely on our local partners.
All right, our special thanks there to Dr. Ann Zink. She is the Chief Medical Officer of the state of Alaska. What a privilege it was to sit down with her earlier today.